And we've got more now on the death of Tyre Nichols and that video of the assault by five police officers. The footage showing the officers beating the 29-year-old after pulling him over. Nichols died in a hospital 3 days later.
The video is, of course, difficult to watch, and many are questioning whether or not they should watch it, and if they do, how to navigate the mental health impacts of seeing violence like this.
Here for more on this is clinical psychologist and Canada Research Chair for Mental Health Disparities at the University of Ottawa, Dr. Monnica Williams. Dr. Williams, good morning. Thank you so much for joining us to talk about this. I know it's something we've been thinking about here in newsrooms. This video, in essence, is watching someone beaten to the point that he died 3 days later. That's traumatic. I think that's a universal understanding. Is this something, this video, you think people should watch? And what are some things we maybe should consider before doing so?
Right. I would actually discourage people from watching the video, especially if they already feel anxious or distressed about it, because watching violent videos can be traumatic. I mean, these are images that are going to be seared into your mind, and watching a person's life taken from them, that's a very serious thing.
Let's talk, though, about the other side of this, about what change can come from something like this being exposed. I mean, there are examples dating back all the way to the release of photos of Emmett Till, who was lynched at 14 in Mississippi in 1955. And then that created this awareness about racial injustice in the South at that time. So it does seem as though seeing something like this can have some type of an impact. I mean, do you think so, that viewing clips like this can do that? Is there anything positive that can come out of this footage being so accessible?
Oh, absolutely. I think these types of videos are essential, actually, to hold law enforcement accountable for how they behave and to improve our systems, and absolutely to provide information and closure to families. And I think that people who need to see it can see it, for example, journalists and reporters. But I really question the wisdom of having these materials so widely available on the internet and social media and encouraging people to watch them, because we really don't need to see someone beaten to the point of death for us to feel sad, for us to feel outraged, and for us to advocate for change.
Yeah, that's a good point, right? Human empathy should exist regardless. And there's also been a lot of conversation about giving warnings before you show that kind of video, or making sure you're giving context too. Now, like you said, though, some people like us journalists have to watch the video to report on it, to give the content. Do you have any tips for people who do choose to watch this, how to care for our mental health, both around the video, but also just during this time?
Oh, absolutely. I mean, for one, it's really important to seek social support after feeling distress from watching footage like this, and support could be from within your community, ideally close friends, caring family members, people who get it, could be allies. And I would say, if you're feeling distressed afterward, definitely take some time to limit exposure to cues of racism while you're recovering. And that could mean signing off of social media for a while. I would say participate in restful and grounding activities such as self-care, spiritual practices, meditation, journaling, even art. And if distress continues, then I would say seek professional help from a culturally informed provider, such as a counselor, therapist, psychologist, or even a psychiatrist.
And that's an important point. Culturally informed. That's an important element of healthcare, too.
Yeah, absolutely. Great point.
Yeah. Dr. Monnica Williams, thank you so much.
Thank you.
You're welcome.